Welcome back to CBS This Morning. Recently created mass vaccination sites like this one outside of Washington, D.C. have become bustling workhorses, you could say, in the fight against the coronavirus. But for many people living in the rural areas, sites like these are impossible to reach. Our lead national correspondent, David Begnaud, is here in studio. He's been looking into the challenges. David, good morning. It's so good to see you, but here's the question. Many smaller hospitals say it just hasn't been easy to get that vaccine.
It hasn't. Good morning, my friend. Good to see you in person, too. Let's start with this. Remember rural America. Wednesday, we went to Columbus, Ohio, where the Ohio State University Medical Center appeared to be the first in the nation to get the J&J vaccine and actually put it to use. For them, it's like an added tool in the toolbox, along with Pfizer and Moderna. Then we drove about 4.5 hours south into rural Kentucky to see how J&J is helping a 25-bed hospital. Welcome to Russell County, Kentucky. Population, about 12,000. Its largest town is Russell Springs. That's about 2 hours south of Lexington and about 2 hours north of Nashville. The only hospital for miles is the Russell County Hospital.
We're not kidding when we say this is rural America. Paint the picture for us.
The things you take for granted going to the corner store or to a big box store, we're driving 30, 40, 50 miles.
Meet Patrick Branco. He is the hospital CEO. He says prior to this week, the state of Kentucky had only sent his rural hospital enough vaccines to vaccinate about 200 people.
They stopped sending Moderna vaccine or Pfizer out to the small rural communities because they would rather get large groups of people. My most vulnerable population in our rural setting have a difficult time getting access to the distribution sites located in the urban centers of the state.
And that's why this was a big deal. Yesterday, he and his team received 200 vials of the Johnson & Johnson vaccine, which can be stored in a regular refrigerator.
When they called me up and said, you're going to get 200 doses on Wednesday, and 2 or 3 weeks, you're going to get on a regular cycle of getting 200 doses every week.
That's huge.
I can start to address this entire county.
Well, the work started right away. In fact, the shipment arrived early. And at a rural hospital, everybody's got to pitch in.
Count the number of vials we have.
Lab director Lois Moore took the lead.
Could you be here at 10:45 this morning?
Cassie Hadley worked the phones, lining up patients.
Well, hi.
Miss Alberta Thomas was already on the list, and she was out the door early. This 90-year-old specifically wanted J&J's vaccine because she knew it would be one and she's done. She hopped out of that car at the hospital, but she didn't want to go inside, though, so she sat out in the meditation garden, and they went to her.
Hi there.
You're going to stick me.
I am going to stick you.
All righty.
There in the Kentucky sun,
That is it.
it was done.
I hope it means that I never will have to have COVID again. I had it.
How bad was it?
The COVID itself wasn't that bad, but the after effects, oh man, I have never known tiredness or weakness. I mean, it was a case of, shall I sit here and starve or shall I actually walk to the refrigerator?
Wow, it was that bad.
That was that bad.
Hearing a 90-year-old lady talk about suffering with COVID like that is partly why the hospital CEO is so thankful to have J&J here.
Johnson & Johnson has brought a product to our community that's easier to administer, easier to store, easier to get into the arms.
And all three of those things for a rural, really rural hospital like you means
sir.
what?
It means we don't leave people behind, and that's my biggest concern.
You can hear it in his voice. We reached out to the state health department for comment in regards to Kentucky halting other vaccine shipments to the hospital. We didn't hear back. It's important to note Kentucky is sending about 100 doses per week to the Russell County Health Department, so it's not just the hospital bearing the burden. And Miss Alberta Thomas, she is 90 years old, and she had 14 kids.
Wow. Wow.
David
She
Begnaud.
really painted quite a picture, David.
Yeah.
And she did not want to go in the hospital. I like how you said she hopped out, but she refused to go in.
She said, I'm not going in. She said, I'll sit right here and you come to me. At 90 years old, you can dictate people like that.
you can.
Order people around like that.
Yes,
And tell people to stick you. I love
May we
it.
all make it to 90. May we all do that.
David Begnaud, going where the big box stores aren't.